Hello and welcome to Echomap, the practical, easy, and above all, useful ultrasound for general practitioners. So today we've got an absolutely perfect clinical case. This is like caviar. We've got everything. It's just like in the textbooks. Sometimes it's not always this clear cut. And sometimes, honestly, it's straight out of the books. That's exactly the case here. If you like this channel, give me a like and subscribe to the channel. Same thing on Facebook. And if you're still not into ultrasound, I really don't get why, because I spend my time making videos to show that ultrasound is useful for general practitioners. Maybe this is the first video you're seeing. Well, click on the link, take this introductory course, and discover for yourself how ultrasound can help you take better care of your patients. So here we have a really fascinating case of a young woman, 41 years old, who is at the end of her rope. She just can't take it anymore. Her sleep is really complicated. She barely sleeps at all. She wakes up early, and she's been extremely anxious for several months now. She has palpitations, chest pain. She's constantly anxious, and she also alternates with some depressive episodes, feelings of sadness. By the way, her Hamilton score was measured at 14. She's on avocado for her palpitations, and on top of that, things are getting more complicated because now they found she has high blood pressure with hypertension at 177 systolic, 80 diastolic, and a heart rate of 90 during the exam. And my colleague, who is examining her as part of her anxiety assessment, does a thorough exam and discovers that besides this anxiety, oh, I forgot to mention that the patient is also on Atarax 25 milligrams, she has a goiter on palpation, a clinical goiter. So my colleague asked me if I could come take a quick look. A quick look with the stethoscope and an ultrasound of her thyroid to check if there might be a little fluid collection. And to be able to take care of her as quickly as possible, even before we get the lab results, especially the thyroid hormones. It's true that it takes a bit of time here to get that kind of test done. And here's what I immediately found. All right, I'm gonna start the video. You can already see that we have a huge, very large thyroid, which seems to be completely filled with nodules. The echogenicity of the thyroid is, let's say, acceptable. It's acceptable. There are areas that are generally echogenic overall. Some areas are less so. And so we have this very lumpy appearance, which we call pseudonodular. Pseudonodular. This is very typical in Graves' disease. This thyroid, which looks very large, you can see the size of the carotid here, an enormous thyroid right away. And when you're used to it, as soon as you place the probe, you immediately think, yes, indeed, the clinical goiter is confirmed by an ultrasound goiter. We switch to a sagittal view and look at this absolutely classic appearance, with contours that still remain generally well defined. Overall, the thyroid is a bit less echogenic in the sagittal view. I still find it slightly hypoechoic, even though there are still some echogenic areas. And then this typical, obviously pseudonodular appearance, where there are so many closely packed nodules, all of them. They're all pretty much identical and hypoechoic on a thyroid. This doesn't make us think of a multinodular goiter. It clearly suggests thyroiditis, especially once you have a bit of experience. So that's already the first dynamic, which is extremely striking. You can imagine that if you do the clinical exam and immediately pair it with an ultrasound, you have your diagnosis within a few minutes during the exam. And that's very important for this patient, who is basically poisoning herself with benzodiazepines, ablocardiol, and so on, blood pressure medications, when in fact, maybe it would be better to treat her Graves' disease. So we're going to do a scan at the level of the isthmus. We see an isthmus that's 9.5 millimeters. It's huge. It's really impressive. Take a look at the overall appearance of this thyroid. It almost looks like the thyroid could swallow the trachea. It's so big around it. And this perfectly typical appearance with its numerous hypoechoic areas within an overall low echogenicity parenchyma, which is this pseudonodular aspect that's typical of baso. So here we have another scan with the right lobe, if I'm not mistaken, and this pseudonodular appearance here. We're going to do a panoramic view of our thyroid because in the sagittal plane, it was impossible to capture the whole thyroid. It was way too big, so I used the term panoramic mode on my device. It's not always perfect, the reconstruction, but honestly, it does the job well. And we have a lobe. Just imagine a lobe that's 40 cubic centimeters. That's huge. You might wonder how no one initially thought of a goiter when we have 40 cubic centimeters per lobe. Let's continue with the other one. Lobe, 34 cubic centimeters on the other lobe. And then, look, really take this in, because this appearance is absolutely typical and remarkable. You'll see it all the time. You'll see it. Absolutely all the time. We're going to do a quick Doppler on this thyroid. And here, it's a letdown. It's disappointing because in everyone's mind, low dose is basically hell. The thyroid inferno with all that activation. And in the end, it's a bit disappointing. We really don't have much. Not much at all in the end. Yeah, we have a little Doppler, but that's about it. So let's try some other areas. I've put together a compilation of several recordings for you. Doppler. And it's nothing extraordinary. All the black and white is typical of low flow, and the color is super disappointing. You should know that this thyroid inferno is only a small percentage of low flow cases. We can even have genuine low flow with the normal Doppler in the end. And yet you can see the settings are low. We're at about 4 centimeters per second, give or take. Personally, I mainly use Doppler. SR, slow flow Doppler to try to increase Doppler detection, and in the end, even so, we still can't pick up the Doppler on this thyroid. So it's always a combination of factors. In the end, thyroiditis, whether it's low flow or Hashimoto's, and you'll rarely see all the signs at once, even in cases where, like here, it's really textbook. We'll continue with measuring the velocities of the inferior thyroid artery. And here, wonder of wonders, we have an extremely high Doppler reading, 2.5 meters per second. On a thyroid artery Doppler, look at the width of this artery. It's extremely impressive. So here, our diagnosis is made instantly, just by performing this pulse Doppler. You heard the typical Doppler sound when blood is flowing at high speed. Already, just by listening, is very impressive. And even if we haven't taken the measurements yet, as soon as we place the probe, we understand what's going on. So we'll continue with the measurements. We'll measure on the right, we'll measure on the left. On the right, we have velocities at 263 centimeters per second. It's absolutely gigantic. On the left, we have velocities at 197 centimeters per second, which is also huge, even if it's maybe a little less impressive than the other side. And look at the aliasing we have within this inferior thyroid artery. That's normal. We have 250 for a setting of plus or minus 4. And despite everything, you can see that, even though the inferior thyroid artery is pulsing at its maximum to feed this extremely demanding thyroid, the Doppler of the thyroid, as such, was actually pretty disappointing, so we don't always have all the evidence. I hope you enjoyed this absolutely classic case of Graves' disease. We were obviously able to adjust the patient's treatment, and she felt much better once we started her on Thyroxol. Because in the end, it improved many of her symptoms, even her mental state. So you see, sometimes it's really worth it, even for cases of anxiety, sleep disorders, palpitations, those somewhat atypical cases. Even if you don't feel a goiter, it's worth doing a quick ultrasound of your patient's thyroid, because sometimes you'll be surprised. If you like this channel, if you find it helpful, give me a like, subscribe to the channel, and do the same on Facebook. And I really encourage you to get into ultrasound. See you soon on Echomap. Bye bye.